Oh man, oh man, oh man.
Hello again. Let me just start by saying apologize for mumbling and stuttering a little bit. This is a lot harder than you think. I'm more of a writing about things kind of guy, posing for photos and stuff like that. I'm not a very confident speaker, especially when it comes to Poland syndrome. Not out loud and not to a damn phone anyways, 'cause it's just awkward. So please bear with me. This is like my sixth take. It's a lot harder than I thought talking to a camera, but I'll hit my cruising speed in a few minutes once I get a bit comfortable. But just bear with me, guys. Anyway, I want to talk about chest surgery. Now, I know a lot of you have thought about this, and I've thought about this throughout the years, throughout my teens, and I'm just gonna give my opinion, and take what you want from it. These are just my opinions, what I think. I'm not a know-it-all. I'm just a guy like one of you lot, just someone else with Poland syndrome talking. I've got a list this time, so hopefully I won't mumble as much. Alright, so surgery, is it for you? That's really, up to you to decide. Uh, Let me just start off by giving you a background of me again, really quick. Like probably most of the men and women who have Poland syndrome, it's really hard to deal with in the beginning, especially if you're bodybuilding. Bodybuilding, you're supposed to be the perfect sculpture, the Greek god. And of course, the chest is the main thing, right? Chest is what makes you a man, big old chest. It's the number one thing. So for me, in the beginning, it was quite hard to deal with, even though I was always quite confident. Uh, once I realized my chest was affected, and once I actually got into bodybuilding, it was hard to deal with. I went through the same motions that you guys are going through. The little phases of depression. Not telling anyone though, really, keeping it all inside. Um, I did consider surgery. I never actually went to the doctor until later on, but when I was 19, 20, I did consider surgery. I remember I still didn't know what it was. All I knew was I had the chest missing. I'd search online and find surgeons and mail them and stuff, and I'd be like, "Hey, there's something wrong with my chest. I don't know. I train and it just doesn't seem to grow any muscle. Would it be possible to fix it?" And I'd send them photos and stuff. And mind you, these were companies in abroad, America and what have you. There was no one in the UK that I could find. I mean, if I had the name Poland syndrome, I guess it would have helped. But yeah, I've been through that whole phase, of trying to deal with it and trying to accept it. It's been so long now, um, since I started all this, training, realizing my chest is affected, that I kind of forget. So I have to go back and remember how bad it used to be. Um, yeah, I know I've been through the phases. I've been through the motions. You don't feel like you're a man, and even though at this stage of my life I'm like, oh yeah, I'm cool with it, blah blah blah. But there's still that small part of me that is bothered. I think that's always gonna be there. I'd quite happily take my top off. I don't have a problem with that. See, again, I'm saying it, I don't have a problem with it, but I guess there is that small part of me that does care. You know, I guess maybe that will go away with age. Who knows? But point is, the older I got, the more I realized that hey, who cares? It's only chess, man. I don't. It's just there's more important things in life, you know. But I do understand it's harder for some people than it is for others. It really depends on the kind of person you are. If you're quite shy and you know not very outgoing and find it hard to talk to people, then obviously it's gonna be harder for you. You need to work on your confidence, and continue with bodybuilding if you are bodybuilding, and trust me, things will get better. That comes with age, that experience, because I've had kids ask me, 16, 17, 18, even 14-year-olds ask me, about surgery, and telling them that it doesn't matter and in time things will get better. It's okay saying it, but that you have to go through the motions, and you just have to live with it, and with time that will come. I know it's hard, you're on social media nowadays. With me, I'm on social media like Facebook, Instagram, YouTube, and you're surrounded by all these guys on steroids and the perfect physiques, and it puts a lot of pressure on you. So I'd advise you to stay away from all that, especially in the beginning. Okay, all right, okay. So with me, the reason why I didn't get surgery is the chest doesn't bother me in the sense that the way it looks, I'm cool with that. I don't mind the way it looks. I actually like the way it looks. It sticks out more in my t-shirt. My shoulder sticks out more in the t-shirt, which is great. But the fact is, the only thing that really bothers me is my arm. Right? If they could fix my arm and it worked properly, I'd get surgery, no doubt about it. But the point is, I can get surgery on my forearm. I can make it aesthetically pleasing and look acceptable, but it won't be the same. It's still gonna cause me pain. It's still gonna hurt when I do deadlifts. It's still gonna hurt when I do pull-ups, any heavy, pulling movements. And to be fair, the doctor's probably gonna say, "Oh, stop training anyway." So that's the reason why I didn't go for it. If I could fix anything, it would be my forearm, which I really don't think it's possible. Okay, maybe it can be done with like a silicone implant, but as far as getting a muscle transfer, that's a no-no. You're not taking any of my muscles, to put into my arm, you know. And as far as getting a silicone implant, I've seen the silicone implants that are out there now, and I know it's 2015, almost 16, but they still can't get it right. The silicone implant, okay, it might look alright at first glance, but if you're living with it, if you're looking at yourself every day in the mirror, I really don't think you're gonna be happy, especially if you're weight training, because you have to understand a silicone implant is just an implant. It just sits there. It's not gonna grow. It's not gonna shrink. Okay, it might shrink. I don't know, but it's not gonna grow. It's not gonna. They're not real muscle fibers. Uh, and the other option is the lat transfer, where they take your lat muscle, your whole back, your wing, and they cut it up and somehow attach it to your pec. So I imagine that will be in here from the bicep. I've been lucky enough now to meet two people who have had this done. One of the guys does weight train, one of them does not. I've met a few people online uh, who have had it done. If you follow me on Instagram, you know. But the people who I've met in person, they've had the lat transfer done, and both of them are not happy with it. The guy who's training, he was telling me that he had his done about 5 or 6 years ago, and as he's progressed in his training, things have not played up. Obviously, if you're missing your back muscle, it's just common sense that that's going to cause you problems later on in life. What would you rather have missing, a pec or a lat? Personally, I'd have a pec missing. They don't take your lat and then give you a new lat. No, you're left with a missing lat. Now think about it. If you're in your midlife, in your mid 30s, 40s, 60s, basically the older you get, the more you need your back. The back is the most common place for injuries, right? Even if you're not training, spinal injuries, lower back injuries, blah blah blah. So it would be very, very wise to keep your lat muscle, right? I could be wrong, but logically speaking, I don't think I'm wrong. I think I'm right. Okay, back to what I was saying. The two people who I've met in person, they were not happy with the way things turned out. I've seen both the pecs, and the guy who's training, he was like me. He's got the upper pec, but it's still very obvious that he's had work done. The pec doesn't look like a real pec. It is obviously a pec, but compared to the other one, it's not real. Also, it didn't flow. There was the indentation, which is really quite obvious. You know, you've got two different types of muscle fibers. You can't just attach them together. I think if you've got the upper, like, you can't see it too much light. The upper, they don't join it. I think they just stick it on and hope for the best. And if you're training, obviously your upper pec is gonna grow, but the new pec, your lat, isn't gonna grow at the same rate. This is from what I gather and from what I've seen. So don't think that I'm gonna look symmetrical. Hey, who knows? There might be a surgeon out there who could do that. But from what I've seen, I'm not impressed enough to say, oh my god, I want surgery. No, it's just not impressive. I feel like I look better now than if I was to go get surgery and look symmetrical and But so realize that even though they can come close, to giving you a new pec, nobody can play God. They're never gonna be able to replicate, you know, a proper give you. What am I talking about? They're never gonna be able to replicate God's work. You're never gonna have a proper chest. Now that's okay if you just want to have enough confidence to walk around topless on the beach, because let's be fair, no one's gonna stare at you that hard unless they're gay for you. But other than that, nobody's gonna stare at you that hard to actually notice that okay, they look slightly different. And so if you want to do it for that purpose, you want to feel confident in the shirt, have it symmetrical, then by all means go for it. But consider all your options. There's the pec transfer, the pec implant. Excuse me. There's which is a silicone implant, I believe. I could be wrong. There's a lat transfer, which just sounds messy. We're gonna take your lat and we're gonna stick it in your chest. Man, that just sounds horrible. Imagine the pain and the time you'd have to take away from the gym for you to heal and recover. And then there's the fat graft. I'm not too familiar with this one. I have read about it here and there. I've spoken to someone, but it was from a different country, so his English wasn't great. But from what I gather is they take fat from part of your body. I'm pretty sure they take your whole fat and they inject it into the pec area. So obviously that would fill out. But again, if you're bodybuilding, it doesn't take a rocket scientist to figure out that, okay, it's still not going to look the same. But like I said, if you just want to look good in a t-shirt, you want to look good in clothes, you want to have that little bit of confidence, then by all means go for it. But look into these options. But again, like I said, yes, these options are available, but it's never going to look the same. It's never going to be a real pec, right? So get that out of your head right now. If you're bodybuilding and you're, striving for perfection and symmetry, balance, all them things, I would say stay away from it, because the closest you can get is, to take a real muscle and to put it in there, which is a lat. And if you're bodybuilding, you don't have your lat, then you'll probably have to give up bodybuilding. That's not to say you can't do any physical activity, but bodybuilding is very strenuous, especially on your back. So if you don't have the lat and you've got a pec that's trying to heal and a lat that's trying to be a pec and heal and fix up and do the job as a pec, that's going to be very strenuous. That's going to cause you problems. Don't look at the doctors as, oh, they're going to fix me. These guys, they know what they're talking about. And I went to my doctor about a year ago, actually. Dr. Gafio, if you're watching this, you still need to ring me back. I went to my doctor and I says to him, I've got pain in my arm. And long story short, I've got Poland syndrome. And he's like, oh, really? I'm like, yeah. He's like, take your top off. I'm okay. And he's like, yes, you have Poland syndrome. Oh, no shit. And he was confused. He's like, oh, okay, well, okay, what? you know, where do you want to go with this? And he literally said, we can offer you the the implant. I just played along. I just wanted to listen to what he had to say. And he said, we can offer you the transplant, and you'll have to go on a waiting list. And that's about it. But the real reason I went to him was for my arm. My arm was causing me pain, and I know why it was causing me pain. Obviously, I'm training, but I went just to see what he can offer me. And so in the end, he's like, I'll find you a specialist, and I'll ring you back. And it's been a year, and I don't know, maybe he's lost my number. Yeah, where's my list? Right, so based on my experiences and from the people that I've met and spoken to, I still wouldn't get an implant. Uh, if somehow, if someone said to me magically, somehow magically I can make all your pain go away, in your shoulder, in your chest, wherever, uh, by giving you this peg, I'd be like, yes, okay, but I would do it strictly for the purposes of being able to train properly, and train harder and live without shoulder pain. I wouldn't do it for the aesthetic reasons. Aesthetically, I am still pleased with what I have, you know. Like I've told you guys, over and over again, keep training and your body will adapt and you will look good. So at this stage, I don't need an implant. I don't want an implant. But if you're a youngster in your teens, I understand. I've been there. Yeah, I'm 28. Not so long ago, I was 18, 15, 14, right? Really think about it. Talk to other people. Join the Poland Syndrome groups. Get involved in the community. There are so many people you can talk to now, right? This is in 1965. Okay, and consider all your options, and don't worry about never being able to get a girlfriend because of your chest. Hey, if you're with someone and they've got a problem with your chest, move the hell on. Get rid. Move on. She's not right for you, or he's not right for you. So yeah, as you get older, it just doesn't matter anymore. There are more important things in life, you know. If you have the confidence and good character, and you're a genuinely nice guy, nobody will care. Seriously, nobody cares. The only person that cares is you. Once you get over that, your life will get a whole lot better. Trust me. Alright, so end of the day, it's up to you. Consider all your options and take your time. Don't rush into it. Don't. I know, Hayes. I don't have a lot of patience. I'm the same. I'd be like, oh, this option is available. Let's go do it without thinking about anything. Just step back and think about it. Okay, well, that's all I can really say. If you do want to get it done, by all means, go for it. But that's up to you. In the day, you're gonna have to live with it. And good luck. I'm sure in England you can, I know it's different in America. You have to probably go private or something. But in the UK, I'm pretty sure if you go to your doctor and explain things to him, I'm sure they can offer you something through NHS. But yeah. Alright, I think I'll leave it there. 18 minutes is enough. Alright guys, I'll see you next time. Alright.
Oh man. Oh man. Oh man.